Welcome into the medical program today, brought to you by the specialty clinics at the Bryan Hospital. And today I'm lucky enough to have a New Yorker on the Zoom mobile with me, Dr. Dana Cohen. And Dana, good to have you in today.
Thank you so much for having me.
Tell the folks just a little bit about who you are and where you're from and all those kind of good things.
So originally from New York, from Long Island, I have been in private practice, solely practicing functional medicine or integrative medicine. I'm an internist, so I'm a trained medical doctor who has chosen to take the path of kind of lifestyle medicine, basically trying to keep people off of medication using diet, nutrition, supplementation, really anything that works. Yeah, so that's me.
I think that's something that's becoming a lot more popular nowadays. And, in my parents' day and their parents' day, you go to the doctor, they give you some pills, they give you a shot, whatever it might be, and you move on down the road. Nowadays, you're trying to avoid going to that doctor if you don't need to, right?
Oh, totally. I started 25 years ago, 1998, with Dr. Atkins. That's how I got started in this whole field. And it was a completely different scenario then. There were very few of us practicing this way. And I'd have to, call a patient's doctor and explain to them what I do and get met with sort of hostility. And now it's like, oh, what are you doing? I want to hear more about that. Are you taking new patients? So and every time I turn around, there's new doctors popping up, which is fantastic because we need more of us. And the truth is, I really look at it as we're actually going back to old-fashioned medicine. We're going back to having the patient sit in front of you, talking about your lifestyle, getting a better history, not spending, 6 minutes with a patient. Patients are demanding it. So it's just, to me, good old-fashioned medicine.
That is good old-fashioned medicine. You're not going house to house nowadays, are you?
No, no, no. I would if I could. I would if I could. To be honest,
Well,
it's not a bad idea.
if you listen to my parents' generation, that's the way things work back then. You'd call the doctor and wouldn't necessarily go to the doctor's office that day. He would say, or she would say, how about if I swing by on the way home at about 5:30, 6 o'clock, and we'll take a look at the kids,
I know.
a whole different
It's
time.
a whole different time. And I think if I lived in a smaller place, I always dreamed of being a country doctor.
There you
But I
go.
chose New York City, so that's not happening.
It works a little differently, doesn't it? Huh? I mean, it'd be a little more difficult to be a country doctor in the heart of New York City.
Yeah. Yeah, but you know what? I don't care what anybody says. New York City is a small town, smaller than people think. You're constantly running into people and you develop a community wherever you go. So, yeah.
So give me a little bit of for folks that are listening and maybe don't have totally this concept down right now. The difference between what we talked about, maybe standard, here's the prescription, here's the pill, go pick it up at Walgreens when everything's done. How do you approach things differently?
So, it's first of all, it's listening and it's time. Those are the big things, right? So very extensive history, physical, all, once again, going back to that good old fashioned medicine, but looking at their diet, looking at not only what are they eating, but what are they drinking? I wrote a book on hydration called Quench. So really talking about, are you hydrating enough? I say this in every podcast. Most people are not hydrating enough. And it is truly the most important thing you can do to treat and prevent chronic disease is first and foremost, learn how to hydrate for many reasons. But and then I like to do a lot of testing. I look at nutrients, I look at diet, I look at lifestyle, I look at toxins, toxic burden and toxic exposure. And start there, and always it's hard. It's when I'm afforded the time, we can do better, so it's a little different than and by the way, and then when you make a treatment decision, my first choice is never a prescription or never a medication. It's always lifestyle changes first. And then if we can't make, unless obviously if somebody comes in with a rip-roaring infection or something, they're going to get an antibiotic. But, bar that, my first choice is not to go with a statin for cholesterol or a blood pressure medication. And by the way, the rules are written as for high cholesterol, lifestyle is always first recommendation for every doctor. Unfortunately, our medical system's a little broken, and our doctors, while they are fantastic, they're not afforded the time to give patients what they need. So it's a little different.
Yeah, it really is. All right, and you brought up three or four real good questions for me here, real quick. Okay, first of all, I always get into the hydration idea with somebody because how many glasses of water am I supposed to have every day, doc? And when you listen to one person, it might be gallons and gallons, and you listen to somebody else, and it's a fraction of that. Give me a little feel for that.
Yeah. Okay. So unfortunately, there's no simple way to measure what is each individual's, best hydration point. I wish there were, but there isn't. So you have to live in your body. You have to know what symptoms to look out for. You have to know everybody's different. Their hydration needs are different. So to say that 8 glasses a day is good for everybody is ridiculous. It doesn't make sense. And so knowing what it is to be perfectly hydrated. So I'm going to give you the one thing that you need to, this is the one thing that everybody should look for. We are meant while awake to be urinating every 2 or 3 hours. If you're not urinating every 2 or 3 hours, you're not hydrating enough. That's the best thing that I can say to somebody. So then you need to do better. And in my book, Quench, we don't necessarily talk about drinking more water. We talk about eating your water. So eating more vegetables, hydrating foods, less processed or ultra processed foods is really the answer, to becoming better hydrated. And the gallons of water a day can be dangerous. So unless you are a super athlete that's sweating a lot, and even that, you have to be replenishing some of that water with electrolytes. And if you're not doing that, you can actually overhydrate. So that's bad advice as well. But unfortunately, there's not one single answer for everybody. If you twisted my arm and you made me give you a number, I would say half your weight in ounces is a better guide. So if you weighed 150 pounds, 75 ounces a day is a decent amount of water to drink. But then again, some people, if they're, drinking some coffee and tea, if they're eating a ton of salads and vegetables and green smoothies, then you don't need to drink 75 ounces of water. You're not, you have to take into account. So go back to what I said. The best thing is to look at your urine output and know that you need to be urinating every 2 or 3 hours while awake during the day.
Well, man, that's good to know, first of all. And secondly, I'm of that age where I get up 2 and 3 times a night. So at least I know overnight I'm doing okay. All right.
Well, if you're doing okay throughout the day, then you can stop your water a little bit earlier, your hydration a little bit earlier, so that it's not interrupting you. If you're fine and you get up to pee and you go right back to sleep, then that's fine. But sometimes that waking more than a few times a night is really disruptive to sleep, and sleep is as important as food, water, and shelter, right? It's that important. So the nighttime stuff requires a little bit of finesse and playing around with your hydration earlier in the day.
Yeah, well, that's something I have to control a little better because I do get up too many times at night. How's that? I can remember my dad telling me that back in the day, and I think, I'm never going to do that. And now I'm an old guy, so that's what does happen. Now another thing, because I think you touched on a little bit, because I've always had discounts. My wife is big into hydration, okay, and she doesn't want me to count coffee or iced tea or any other beverages that I drink. So if there's liquid in it, okay, or if it's a fruit like a watermelon or something like that that has a lot of water related to it, that does factor into how much fluid you're consuming in a day.
Absolutely counts. I love telling people this because I get cheers when I tell them that coffee counts, tea counts under a certain amount of caffeine. So it's around 300 milligrams a day of caffeine, which is around 4 cups of coffee a day, can then become a diuretic, or, so that you're losing water from it. But anything before that, it counts. So that's a big deal. And that's, that's a yay for us coffee drinkers. But I want to say, if I were to drink 3 or 4 cups of coffee a day, there's still caffeine in that. And caffeine is a drug, and it can make me, really sort of antsy and nervous. Like I don't feel good if I have more than 2 cups a day. So you just have to sort of take that into account too. We're not talking about the drug caffeine. We're talking about the diuretic or the hydrating effects of coffee.
There you go.
Yeah.
And what happens if I overhydrate?
So that we talked a little bit about that. So the overhydration is, there was just a horrible story in the news that a young woman died from overhydration. She had drank a bunch of water after, I think a long run or something after some exercise, and she kept drinking, and she ended up dying. And it was a horrible thing. It's extraordinarily rare, just so people know. But I'll tell you what's not rare. I see on a weekly basis a few patients a week that have electrolyte imbalances on their blood work. And I ask them, how much water are you drinking a day? And they're like, I drink a ton of water. You're drinking too much water. So you're actually drinking so much plain water that you're flushing out your electrolytes. And then I ask them, do you get leg cramps? Do you get, and they're like, yes, I get them all the time. So it's more common than we think. I mean, obviously not the horrific effects, but electrolyte disturbances are common. And I do think that we can overhydrate with plain bulk water, meaning sometimes you may need to add a little electrolytes to that water, like in the form of natural salts. I'll have people in the morning add a pinch of real salt, which is like a rock salt. That's actually a brand called Real Salt that I love, or Himalayan pink salt or sea salt. That salt has the full spectrum of minerals in it. So it holds on, it gives you all those trace minerals that you need. And that, and you don't have to salt every single glass of water, but if you're finding you're drinking a lot of water and your electrolytes are disturbed, then you should add some electrolytes and maybe cut back a little bit on the plain water. And better yet, eat your water, have more fruits and vegetables.
What about all the sports drinks that are out there nowadays that talk about the electrolytes and adding electrolytes? Can you overdo those, or are those a very important part of this plan?
No, I think you can overdo them for sure. But if you're an so first of all, a lot of the stuff out there, including like the biggest name brands, are just loaded with artificial ingredients, artificial flavors, artificial colors, artificial sweeteners. You got to look out for those things. In the book, we do give a recipe for an electrolyte, do it yourself electrolyte mix, which is so easy and simple and probably the best way to do it. Full disclosure, I'm on the board of a company called Cure, which is an electrolyte mix, and it follows the World Health Organization's for replacement electrolytes, nothing artificial in there. So there are things that you could do, but you don't want to do every single glass of water with electrolytes. Those are best used after an endurance run, or you've sweat a lot, or before going into like a hot yoga session, or first thing in the morning, but you can overdo them. You don't want to do more than one a day, or two if you're really super active.
Interesting, because I think there's a lot of misconceptions about both those items.
Yeah.
Not being able to drink enough water at times, or drinking too much water at times, and then pounding the sports drinks as well. Hey,
Yeah.
we do classic hits on this radio station. We play a lot of songs from the 80s, the 90s, and I do have a female audience that's very strong, of 45 years and older. Okay, and we don't ask anybody their age. Okay, here.
Yeah.
I know
Good.
there are a number, and that's the reason you're with us today. And Dr. Dana Cohen is our guest right now, because there are a number of things that type of audience and my listeners right now probably overlook, or don't think about, or don't want to talk about on a day-to-day basis. And that's what we need to get into now. So let's throw that at you. What are some of the things right now that men and women just don't like to talk about?
Yes. So my favorite subject, probably 90% of my patients are menopausal women. So I really do love to talk about this stuff because I do think it's overlooked. I feel like, for a long time, women, and especially since that Women's Health Initiative study that came out many years ago, where it said that hormone replacement was a bad thing to do, and people were pulling their patients off of all hormones. And I think that was a mistake. So I think that women some women can really suffer through perimenopause and menopause. And if you're suffering, if you're not sleeping, if you have joint pain, if you're hot flashing all day, it's important to talk about. It's especially important to talk about with your partner too. You need to feel comfortable with your partner, and have these conversations, get them involved. I also want to talk about, hidden viral risks of in our 40s and 50s, maybe if our immune system's down. We'll talk, I don't want to have a conversation about that, specifically HPV. I love talking about HPV because right now, regular medicine doctors have nothing to say. It's basically, you go in, you get your pap smear, you're diagnosed with HPV because you have an abnormal pap smear, and it's a watch and wait situation. I definitely have better ideas for that. So I want to talk a little bit about HPV and menopause stuff, and even some, sort of uncomfortable bedroom conversations.
Yeah, no doubt. Dana Cohen, our guest, Dr. Dana Cohen, right now. Before we take our break, let's get into menopause. And it'll be very appropriate for one of my sales reps right now, who is always coming in, waving her hands and telling me that she's having that hot flash all of a sudden. Define menopause for me at this point in time, and tell me a little bit about how we can work with something like that.
Okay, so there is a definition of menopause, and that definition is having blood levels that are consistent with menopause. So estrogen, progesterone, all these different hormones in our bodies. So there's a very specific numbers. So those blood levels consistent with menopause, and then a year without a period. So, but I'm going to just tell you, you can have those symptoms in perimenopause, and you can have those symptoms way post, losing your period, years after losing your period. So it doesn't really matter. The definition doesn't really matter. What matters is that you're able to talk to your doctor, let your doctor know that you're having these symptoms, it's affecting your life, and come up with a plan to help you deal with them.
And what are some of the better ways of being able to deal with something like that people should be aware of?
So, lifestyle. Always start with lifestyle. Exercise, eating well, eating differently, maybe changing out your diet, eating more whole foods, getting rid of ultra processed foods. Of course, all of those things are important. Hormone replacement, hormone replacement is now. Earlier this year, there was a big article in the New York Times that's saying doctors needlessly pulled off all their patients on hormones when they shouldn't have done that. That's the studies of the Women's Health Initiative were really overread, mostly by the media. The media is who really led that whole crusade of taking all these women off of hormones, and doctors followed because they were afraid, So that's kind of been reneged. You want to make sure you find a doctor, preferably a doctor who practices integrative or functional medicine, who's really well-versed in hormone replacement. But I have to say, it's life-changing. It's life-changing really quickly, and we shouldn't be afraid of it. And there's a lot of information out there about hormone replacement for menopause. And then there's herbs that we can take. There's tons of supplements. Maca being a great herb that you can put in your very hydrating smoothie, green smoothie, because that's really the essence of Quench, what that book is about, eating our food. So green smoothies are the star of the show, blended greens with whatever else you want to put in there. You can put some of your maca powder in there, can really help with hot flashes and some of those things. And it just depends. There's lots of things that you can do depending on what the symptoms are. If it's sleep, then you need to talk to somebody who knows, and medication is always last for sleep. There's been no sleep medications that have been proven to be really good for you. Now, if you're not sleeping, you're not healthy. So I absolutely recommend trying supplementation first. And it may require layering different supplements. And there's a lot out there. So finding somebody who's knowledgeable in that too is important.
Have we come a long ways? And I ask you this question because I know somebody who went through menopause and they never got her hormones correct. And she has just absolutely had a 20 years, 25 years of nothing but pain and suffering. Are we better nowadays than we were 25 years ago at prescribing and working with somebody like that?
I absolutely believe so. I myself typically use a compounding pharmacy where I can, down to the 10th of a milligram, prescribe a dose of whichever hormone I'm going to prescribe. So I do think that so many doctors are so much better, so much more knowledgeable now and understanding of hormones. And that's the problem I have with now, while many of the prescription hormones are what we call bioidentical, meaning exactly identical to our bodies, which is not what Premarin, what that study was done, the Women's Health Initiative. But the bioidentical stuff, you can only have a few choices of dosing. So somebody like that may have needed to go to a compounding pharmacist and play around with it. Sometimes it's hard, and there's hormones, and I'm just going to say, like, we'll get into like the libido conversation. I have women who come to me and saying, I have no libido, and sometimes it's not just hormones. It's complicated. There's so many other things. You've been married to your partner for 25 years. Like it's complicated, So it's not necessarily only hormones, but when you start to look at a person from as a whole, and you start from every organ of their body, and you go through every system, and you go through a systems approach with somebody, you're bound to get it right easier, better.
Yeah. Yeah. Well, let's hope, because probably technology and everything else is better now. But at that point in time, total 100% faith in a doctor who led her one direction. And unfortunately, I think at that point, and now we've proven it over 25 years, it was maybe the wrong direction at that time. So
Yeah.
Dr. Dana Cohen is my guest right now. I need to step away and pay some bills. We're in the middle of the medical hour. When we come back, we will talk about some of the different things that women that listen to us right now might be thinking about, as far as the amount of tests and the times they need to go to the doctor, and also some of the things that we don't like to talk about. You got the Q, 96.5 FM. Dr. Dana Cohen with me here today, and we're in the middle of the medical hour. And Doc, let's talk about some of the important sessions and screenings that women ought to be aware of if they're listening right now.
Yeah, so we have your typical ones, mammograms, especially if you're on hormone replacement, you need to screen. While I think we talked a little bit about the Women's Health Initiative study, we've shown that by taking hormones, it doesn't necessarily increase your risk of breast cancer. It does a very slight amount. So screening is super important, especially when on hormones. So mammograms, but pap smears, people think, oh, I've been with the same partner forever, and I don't need, maybe I don't need to do my pap smears anymore. That is absolutely wrong, because cervical cancer is a real issue. And as we may all know, that cervical cancer is caused by a virus, HPV, human papillomavirus. And it's when our immune systems, so let me just take one step backwards. If you've ever been sexually active, you have been exposed to HPV. It is rampant. HPV is something like that we've all been exposed to. It stays in our bodies. And typically when our immune system is robust, it fights it off, right? When our immune system goes down is when that HPV can become active and wreak havoc on our bodies. And it's not only cervical cancer, it's throat cancer, it's rectal cancer, it's vaginal cancer. So it can affect men as well. And unfortunately, we don't have a great way to screen for HPV alone, right? The only way we can screen for it is doing a pap smear, seeing if there's abnormal cells, and if there's abnormal cells, then we know that's HPV. And as I said earlier, HPV right now, the only thing we have in regular medicine is watch and wait, right? So, oh, you have an abnormal pap, we're going to watch and wait, repeat it in 3 to 6 months. Let's see where we are. Let's hope it clears on its own. So and even though we know that it's based on our immune system, there's still nothing offered. So I'd like to just give three offerings. The first is, we talked about it, hydration. Hydration, the single most important thing you can do to treat and prevent chronic disease. Learn how to hydrate better. Okay, so that's number one. Stress plays a huge role in wreaking havoc on our immune system. So whatever that may be for your listeners, to de-stress, whether it's talk therapy, whether it's meditation, whether it's, a soak in a bathtub, whether it's don't quit your job, but maybe quit your job. I don't know. So you have to figure out what that de-stress is going to be for you, because it really is, stress kills people. And we don't say it enough. We don't talk about it enough. We don't give enough options. So deal with your stress. And then, so those two things can work on your immune system. And then I want to just talk very specifically about bolstering your immune system, or I typically don't like to use the word boost or bolster, and specifically since COVID, when everybody was talking about boosting your immune system over COVID, that was actually the wrong thing to do, especially early on in the disease when the bug was so virulent and so strong. You don't want to boost your immune system. It could actually have thrown you into like a bad scenario. You want to modulate your immune system, right? And that's things like vitamin D, having proper vitamin D levels, get your vitamin D levels checked. You want to do things like eat well, once again, I can't say enough, get rid of ultra processed foods. Uh, as far as, supplements, folic acid, they've shown that people who have HPV have lower folate levels in their blood. So you want to boost up those folate levels by taking folic acid. And then I want to talk about one of my favorite supplements. It's called AHCC. It's a mixture of medicinal mushrooms. There's actually a ton of research. There's a great website, ahcc.net, that you can go and look up all the research that they did on human studies, which is rare. And what AHCC has been shown to do is that it's shown to clear HPV faster in people who have been found to have HPV positive abnormal pap smears. So AHCC is a phenomenal supplement. It's actually one of the most widely used supplements in Japan for cancer patients, which is very interesting. It's great for preventing cold and flu. I take it during the flu season as well. So those are three things you can do instead of just watching and waiting.
Yeah. Where would you find that supplement if you're listening right now and you're wondering?
So ahcc.net. I think they probably have a way of finding. Actually, if you can go to my website.
Okay.
Duh. It's www.drdanacohen.com. drdanacohen.com. You can go to my dispensary called Full Script, and if you put in HCC, it'll come up.
This is not something you would find at Walgreens.
You wouldn't find it at Walgreens. You'd probably find it at a higher end health food store.
Okay.
I think you could probably find it online. There's a lot of different supplements that contain the raw ingredient AHCC in it. But I think AHCC.net, they have to have a means of telling you where to go and get it. That's such a great question.
Several health stores around our area right now that seem to be very, adept with things like that. So maybe that's a good place to start as well. Or go up to your website and hook up from there too. Any way to get people involved. This helps to clear the virus from the system. That's what happens.
Yeah, they've shown that women who were HPV positive, abnormal pap smears, took, and the dose it's a high dose. It's 3 grams a day. So you divide it 1.5 grams twice a day over a 6-month period. They've been shown to clear HPV better and faster than those who didn't take it. So it's sort of fundamental in what I do when I treat somebody with a positive abnormal pap smear.
Wow. And is it good for all viruses? So, I mean, if you did have,
Yeah. So like I said, cold and flu, it's been, there's, if you go to that website, there's been studies about cold and flu. There's also studies about COVID. So treating and lessening the duration of COVID, there's some studies, and preventing COVID as well. Yeah, there's some other viruses. I can't think of them off the top of my head, but there's a ton of research on that website if anybody's interested. And I don't treat cancer in my practice, but I think anybody who has cancer should ask their doctors about this supplement, especially if they have something like something called neutropenia or a low white count. I know AHCC is used in that scenario.
And you alluded to the fact that these are mushroom related. These are the magic mushrooms that I knew as a kid there.
No.
We're not going on any kind of trip there or anything like with
No,
Jim Morrison or anything, are we?
these are edible medicinal mushrooms.
Okay.
So not the kinds that are very widely and very interestingly being used now, like the psilocybin, that kind of stuff. No, it's not that different. But nonetheless, that's a whole nother topic that I'm very interested in for trauma and depression and that kind of stuff. But no, that's not what we're talking about.
you know, I think the one thing that has stuck with me for all the years that I've been walking this earth right now is if it grows out of the ground, it's probably not too bad for you. There are useful purposes for what comes up and grows naturally on this planet.
This is why I wish I had done things a little differently in undergrad. I would love to have studied herbal therapy. I think herbalists are a very interesting. I've done some courses here and there. I've actually taken years of courses, and I still don't know enough. But I do think plant medicine is fascinating and interesting, and we have so much to learn about it. But yes, plants are Mother Nature is so wise. She's wise, and we don't give her enough credit to know. And we're learning. We're finally learning, hopefully.
Yeah, yeah. Well, let's hope.
Yeah.
We can only hope. That's all we can do is cross our fingers and hope.
Yes, that we need to take care of our planet because Mother Nature has our backs,
Yeah,
and
she
and
really
and
does. There's no
we
doubt.
don't have hers.
Amen to that. Hey, we talked a little bit about libido in women over 40, okay, and trying to maintain a good sexual relationship in a marriage or any kind of relationship that's going on. But there's also times when there's some subjects that can be very difficult to talk about. How do we have those conversations?
We just need to have them. I think the mere fact that you and I are doing this and talking about this opens up that door. So I think, we can't be shy with our own partners. Vaginal dryness, urinary incontinence, it happens to men. Men talk about it frequently. Like they have no problems in talking about this. Women can't be shy about this. And so I think it's important to have these conversations with your partner, let them know that you're having issues or that you're struggling, and then especially let your doctor know. A few years ago, it was very widely known that doctors were treating women differently with heart disease. And until we started talking about it, that would have still gone on today. That women were being undertreated and under talked about for heart disease and heart disease symptoms because the studies were not done on women, and everybody thought, well, women live longer, they don't get heart attacks. Turns out that's not true. And now, since the American Heart Association has made this, Women's Heart Health Month, that has really changed, and it's changed doctors as well, which is so important. So just the mere fact of having this conversation, opening up the conversation. I just say about urinary incontinence. I want to have a little bit with women. I want to just say that you don't even have to have had babies to suffer from urinary incontinence, which is I think gives a lot of women pause to like be relieved. Like, oh my God, I turned 50, I went into menopause and I'm sneezing and coughing and getting some leakage. It happens to so many of us, so have the conversation with your girlfriends, have it with your doctors, have it with your partners. Specifically also the HPV thing, like we said earlier, that's important to talk about with your partner. It doesn't mean that, somebody was cheating on somebody, because it could be lying dormant in your body since we've all been exposed to it even earlier. And then let alone, the amount of divorce rates and that kind of thing. Like just because you're 50 or in menopause doesn't mean that we have to lose our sex drives or that we have to, that sex is out of the question, because it's certainly not.
Yeah, that can continue until the day that you die.
Absolutely. As well, it should.
As well it should. It cuts down the stress level. Okay.
Yeah.
Yeah.
Yeah. I mean, it makes for a great relationship. I mean, there's, that's everything, it's part of a relationship. But I also want to say it doesn't have to be full on sexual intercourse. There's different levels of intimacy too, so having that conversation with your partner, what works for both of you, I think is really what's more important, than just sort of blanketly going about the sex talk, so I think the intimacy talk is more important.
Yeah, no doubt about that.
Yeah.
Why is it that we can talk about almost anything with our buddies on either side? I mean,
Yeah.
my wife and her friends, myself and my friends, but then when it comes time to sit down with somebody that you've been around for all these years and
Yeah.
gone through so many things you can't talk about.
I think it's just take that step. It's just being brave because you'll be
Yeah,
surprised. I mean, you'll be surprised at what your partner, wants to talk about. And of course they want to talk about it. I think by sort of sweeping it under the rug or not talking about it is more detrimental.
no doubt. Dr. Cohen, I really appreciate our time today. We're about running out of time. If somebody would like to follow through and look any of these things up on your website or any place else, how do they get in touch with you, or how would they look these up?
So my website, drdanacohen.com. But yeah, there's an email. You can sign up for my newsletter, my social media. So and then you could look at the book Quench. It's available on Amazon. It's a great book. It's helped a lot of people, I have to say. I'm very proud of it.
Yeah, as well you should be. And I'm glad that you cleared it all up for me today. And now when my wife tells me I'm not drinking enough water, I can point out the 27 cups of coffee that I have every day. Okay.
It's too
And
much.
all that watermelon that I eat on every afternoon. How's that? And
All right,
she'll
that's
look at me,
better.
call me a smart aleck, and she'll realize that it had nothing to do with our conversation, and I'm making it all up again.
I love it. I love it.
That's the way that it goes.
Yeah.
Dr. Dana Cohen, thank you very much for your time today. With that, we're back into Classic Hits here on the Q 96.5 FM.